Well, today we visit with Dr. Bushra Shah about some information very important to women. You've no doubt heard about hot flashes, or maybe you've experienced them for yourself. It's just one of several possible symptoms of menopause, and today Dr. Shah is here to tell us a little bit more about it from the Longevity Center at St. Vincent. Welcome back.
Good morning.
Good to see you. Let's talk about what causes the hot flashes.
Hot flashes are definitely the most identified symptom of menopause, Melinda, and 75% of women in the United States do suffer from hot flashes, or what we call the vasomotor symptoms of menopause. And basically this is a dysfunction in the thermoregulatory system, starting from a part of your brain called the hypothalamus, and it's the real cause is not known for sure, but the most likely cause that is associated with it is estrogen withdrawal as the body gets older and the ovaries do not produce as much estrogen and progesterone. And these lead to vasodilation, which is in the arteries, there's increased flow of blood, and this causes the flushing symptoms, and they usually are centered around the face, the upper part of the body, the chest, the back of the neck, and there's a sudden rush of heat. And after that there's perspiration, which is the body's way of trying to cool down, and then this reduces the body temperature, and women experience shivering, and this is to try to normalize the body temperature. So this is what a hot flash sort of entails.
Yeah, and many times while they're sleeping, but can it happen during the daytime hours too?
Yes, it can happen once or twice a day to every hour when you're sleeping. It wakes women up from their sleep. Typically in REM sleep, that's when they do not experience it or least experience it, but in the earlier stages of sleep, they still experience hot flashes, and that wakes them up. And insomnia is one of the other symptoms associated with the hot flashes. That's
You can imagine it's hard to sleep when this is going on in your body.
Yes.
Let's talk about the treatments, and I know there are many different types.
Nothing treats hot flashes better than estrogen, because like I said, the cause associated with it most likely is estrogen withdrawal. However, not everybody's a candidate for estrogen, but short-term estrogen therapy for 1, 2, or 3 years, definitely under 5 years, is what is now prescribed. There were certain studies that came out indicating that prolonged estrogen and estrogen progesterone usage can lead to certain adverse effects like breast cancer, cardiovascular events, strokes, and blood clots. So therefore, estrogen progesterone therapy is recommended for women with moderate to severe vasomotor or hot flashes, but there are other options as well.
Okay, let's talk about some of those.
Herbal remedies, as you may have heard, black cohosh, kava, soy, and red clover has been suggested. But anytime you use any of the herbal remedies as well, Melinda, you must talk to your doctor, because these can still interact with some of the medications that you might be taking, and certain conditions like fibroid tumors, uterine, ovarian, or breast cancer, liver disease, protein S deficiency, kidney transplant, these patients still should not take black cohosh. There has been scientific data supporting that black cohosh does help with hot flashes, whereas for kava there is no scientific evidence, but women seem to report that it does help. It was really for insomnia and anxiety associated with the menopausal symptoms.
So it's really something to tackle with your doctor, whichever route you decide to take.
Yes, definitely.
Okay, let's talk about some of the triggers and things you can just do to keep cool, you know, just to try to be more comfortable.
Some of the most common triggers are cigarette smoking, caffeine, hot weather, spicy food, tight clothing, and avoidance of such triggers is the best way to go. You know, and you can't, if it's summer, you can't avoid the hot weather, but anticipate, wear layers so that you can in cold weather you can take them off. Wear clothing which can breathe better, like 100% cotton. Try to drink cold water. even chilling your pillows sometimes helps with the sweating and trying to cool yourself down. At night, use a fan. Keep your bedroom cool. If your spouse or your partner doesn't get on your case about it, but a lot of times I know my mom and dad, they're always fighting about turning it down and cranking it up. But certainly those during the day, have a fan on, so avoiding excessive alcohol beverages, or if you think that that's going to bring it on, or caffeine, try to go decaf. Avoiding spicy foods. Those are some of the things that you can do to help reduce the onset of hot flashes.
You mentioned the pillow, and I think they even make some pillows now specifically for this that can be cooler. If you have hot flashes, does that mean you're going to have them the rest of your life?
Unfortunately, for some women, it is a constant. After, and some women can start it as early as their early 40s, and for some women it starts after menopause. So it can vary from individual to individual. For some women it's a few months to a year, and for some women it just continues for the rest of their life.
Well, something to definitely have a conversation with your doctor about. If you're starting to feel this, if you've been through menopause, definitely get with your doctor to be sure that you are progressing through that. The Longevity Center, of course, at St. Vincent is a great resource for information about all of this or any of your health issues as you age. If you need an appointment, you can always call them at 552-4777. Dr. Shah, thank you so much for coming today and telling us a little bit more about it. I think we all understand a little more.